Okay, good afternoon. My name is Dr. Garais. This is PHT110, and we're doing Chapter 6, Week 5 work. And Chapter 6 is preparing injectable medications, but if you look at the syllabus, we have to look at dilutions and concentrations. So let's keep on track. Let's go through this relatively quickly, and then let's get to some dilutions and concentrations. Okay, so we see the learning objectives and calculate volume, calculate the amount of drug, and we've been kind of doing this a little bit. Okay, how many units per dose? So it's kind of like the same thing that we've been doing, but now it's to deal with things that we're going to use an injectable form. Okay. So that's what parenteral medications are. Also, you can also have parenteral feeding. Sometimes the patient needs to be fed via IV. It's a temporary situation, but a situation that's required nevertheless. So injection, another is infusion. So these are in parenteral, which means that what? That is, you are giving things, medications that are outside your gastrointestinal system, right? All the other things that we were talking about that you take PO or per oral have to go through the GI system. Now, from your pharmacology class, you know that this is really neat because then the drug can get to you faster. But this is also not a good idea because let's say if my dose is wrong, I can also overdose you a lot quicker or underdose you a lot quicker. Some examples of parenteral are SC, or subcutaneous. Some of the old school physicians and pharmacists use the abbreviation sub-Q, SUB space Q, for a subcutaneous injection. IM is intramuscular. IV, of course, is intravenous infusions. Okay? And they have different types of volumes, 500 to 1,000, 50 to 100 cc's. But whatever it may be, whether large or small volume, remember, liters is a measurement of volume. mL, milliliters, is a measurement of volume. cc, cubic centimeters, is a measure of volume. Okay, and remember, ml and cc are the same thing. Okay. Okay, let's look at this. Calculating the volume of an injectable. And let's see. Okay, let's see if you can see that label. And it's midazolam hydrochloride. It's an injectable, 5 milligrams for 1 ml. There is, this vial has, how much in it? It comes in 1 cc or 1 ml vial. So the question is, how many milliliters of the medication shown in the label below must be prepared to provide 12.5 milligrams to my patient? You know what? Just for argument's sake, let's make the math easy. Let's make it 15 milligrams. Okay? So now let's move over to the board here. And again, our classic labels. If you see our classic labels, is what I know, what I don't know, and what I want. So how many milliliters is medication? So that's what I want. What do I know? It goes, what do I know? I want to deliver 15 milligrams. That's what I need for that particular dose. Remember, I need to get this injection in. Now, if I look at the label reads 5 milligrams per ml. So I know that too. Okay.
Where is the 15 milligram?
I just changed it. I changed it from 12.5 to 15 so that the math will be easy.
Oh, okay.
Okay? So in the book it says 12.5, but I put it to 15 so the math will be more straightforward. So I'm looking at that. So how do I do this? I start off with 15 milligrams. I set up my conversion. What do I want? I want ml. So what goes on the top of this conversion? ml. Milligram. So I have my conversion, 5 milligrams per ml. 5 milligrams for every 1 ml. 15 divided by 5. The milligrams cancel out. I have what? 3 ml. So, for example, this vial only comes in 1 cc or 1 ml vials. How many vials do I have to get? 3 of them. And I load that injectable. Another question I could ask. 1 cc tuberculin syringe, 5 cc syringe, 10 and 15 cc syringe. Which one do you prepare with the 3 vials? The 5 cc syringe.
3.
So here's an example of another kind of question. Which injectable which type of injection do I get? Do I get a 1 cc, 5 cc, or 15 cc needle that I prepare for this? Because that's also another thing that some pharmacies do. They prepare a little bit of the equipment and they put it in a little package. So you wouldn't get a 1 cc, right? Not enough. You wouldn't get a 15 cc. It's too much. For a 3 cc delivery, what do I need?
Okay, my question, where do you get that?
These are typical sizes of syringes. I just made that up. But that's a kind of question, the kind of thing that you also see. Which syringe do I have to give?
Okay.
Which syringe do I have to prep?
So I need to memorize the sizes of the syringe. So
Yeah, I hope you guys did. That should be in your pharmacology class. Okay, so look at your pharmacology book, look at it again. Because remember in your pharmacology class, didn't they teach you how to do a subcutaneous injection, an intramuscular injection, how to do injectables? You don't remember? Well, look in your textbook. And if not, give me a call, and we'll do an extra class on what syringes look like, and what are the different sizes. Why are the different needles that have different colors, that kind of thing. But just for our purposes, for this class, let's say let's not even look at this extra question. For our purposes, what do you have to always have? What you know, what you don't know, and then what you want. And as you can see from the midterm, where did we find what you know? This thing was on the what? On the label. If you also notice that there are a whole bunch of different other numbers that are on this label. You should be able to know how to read the label. Which numbers are you supposed to be looking at? Okay? So, let's go on to another type. Oh, looky here.
syringe, yeah. Yeah, that's
If you look at here, that's a 3 cc syringe, a 3 ml syringe. Okay? But remember, we changed the example to make the problem easier mathematically. You look at this problem. How many milliliters of the medication shown in the label must be prepared to provide 8 milligrams of ondansetron? And ondansetron is what? From your pharmacology. What do you remember ondansetron from? Right? If you don't remember, look it up because it's quite popular in oncology, and it's quite popular for patients on chemo.
Oh, cancer, it's a cancer.
Yep,
Right?
because what do they do when they're, what do you keep on doing when you have chemotherapy? Keep on vomiting. And then in extreme cases, we give ondansetron to hyperemesis gravidarum, when mommies, pregnant mommies are having a really, really hard time keeping their food down. And as you can see here, remember just from the midterm, here's the concentration, how much is in the vial, 2 cc's or 2 ml, of course NDC number, expiration date and lot, very important to document. And you can see from the label what are the problems with the ondansetron. It's going to give you stomach problems, and it's going to give you what? Mentation or cognition problems. One of those meds that, you know when they say don't, do not take when operating heavy machinery. Well, these are one of those drugs. So there's pretty much the same kind of question. How many milliliters of medication shown in the label below must be prepared to provide 10 milligrams of adenosine? You see a pattern here? It's the same question. How many milligrams of carboplatin in 30 cc's of the solution shown below? So this whole entire chapter pretty much is one big. It's the things that we've been actually doing. Okay. Let's now move on to this example, and which will be relating to our next topic, which is dilutions and concentrations. Now, of course, a dilution is something that is of a weaker strength. When you want to dilute something, you add more solvent or water, right, and it cuts it down. But if you want to concentrate something, you remove solvent, you remove water, and then it concentrates up. Okay? So let's look at that. How many grams of pure drug are in 5 ml of a 1 to 200 solution? Okay. So they use, again, the same methods that we've been using. Now, if you do X amount of grams per 500 ml equals 1 gram of 200 ml. Now, if you look at that problem, let's see if you could see it. Yeah, it might be a little bit too small. Let's do it here on the board so you can see it a little better. All right. So.
Can I?
Yeah.
Can I use that formula, the one that you just said?
Yeah, that's what we're gonna show you how you figured it out. So when you look at it, what do I know? I know I have 500 ml of some sort of solution. The solution concentration is 1:200. Right? Now on these concentrations, the 1 is the solute, and the 200 is the solvent. And remember from your pharmacology, solute is the what? The drug. The solvent could be alcohol, but it's usually water. So 1:200. Now, if you look at, and this is on page 180, example 6.1.7, if you look at the ratio proportion method, okay, what I don't know, or what I want is X grams. I have 500 ml. Now, if I have a 1:200, so how many solute or drug? 1 gram. 200 ml of solvent or water. So now I can do what? Cross multiply, solve for X, and if you look at the math on page 180, it's 2.5 grams. So if I want to make a 1:200 proportion. 500 cc's, what must I do? Or 500 ml, I have to put 2.5 grams of the drug. So there's two steps to that problem. One, right, you have to understand what the ratio is, what the ratio means. A 1:200 ratio means there's 1 part solute, 200 parts solvent. 1 part drug, 200 parts liquid.
It's the same, like if you look at the problem, it's like I can just use proportion for the question, you know, like.
The proportion method for calculating ratio strength, right, is kind of easier. And as you can see there, but you must understand this part. What does 1:200 really mean? 1:200 really means what? How much solute is to solvent? How much drug is to liquid? How many grams is to milliliters or liters? How much weight is to volume? All means the same thing. Let's see if I'm in picture or I'm in focus. Okay, good. This is a big one, calculating ratio strength. Really important. Let's try another one.
So, you mean the solute is 1, right? Is that all?
Yeah, everything's all on the same side. If you look here. Right, so in a 1:200, the solute is what? 1. What's the solute? Your drug. How do you measure the drug? Usually in grams, which is a weight. And that's why I'll put it all together. Now, what's 200? The solvent. What's the solvent? Usually water. But it could be in oil, it could be in alcohol, it could be in a whole bunch of things. And how do you measure a volume? You measure it in what? Liters. And in this particular case, milliliters.
So 500 ml is a solvent, right? It's milliliters.
Yeah.
Right?
500 ml is the solvent. How much water we have? Because for this particular case, right, I only need 200. But this, our patient, what do they need? They need 500.
Okay.
So, how do you make a 1:200? You put 1 gram into 200 ml. And remember your understanding of converting a fraction to a percent?
Yeah.
So this is essentially, right? If this was 100, this would be what? What would X?
1, right?
What would X be? If this was 100 ml, how many grams would we put?
Right? 2.5 grams. The X.
No. Why would it be more? This is X. 2.5 grams in 500 cc's. Let's call this Y. If I only need a 100 cc solution, how many grams do I put? Oh, 100 is half of 200. What's half of 1? 0.5 over 100. Right? Percent, right?
Yeah.
So what percent solution do I have here in the 1:200?
5.
I have a 0.5%. Very small. Okay? This is a classic question. Ready?
So for the formula, you don't write that what we want. right?
Yeah, because it's a ratio. Remember, what you want, what you don't want, right? Well, it still applies, but when you're doing the dimensional analysis method, that's the one where, you know, where what I want is always on top. But this is a proportion.
Okay.
An equality. Remember? This could be one problem, this could be another problem. But it's always based on this thing, right here. How much solute is to solvent? How much drug is to water? How many grams is the volume, right? Or ml? Weight is the volume. It's all the same thing. Okay?
Yeah.
So if you take a good look at the board, take a good look at your textbook, and we're on page 180. If you look at those examples, they're all the same thing. Right? You see? It's at a proportion. 1 is to 3,000, 1 gram is to 3,000 ml. I want to make a 5 ml solution. So I put 5 ml on the bottom, X on the top, solve for X. Let's look at another one. Same thing here. I want 1.5 ml of a 1 to 1,000 solution. What does a 1 to 1,000 solution look like? 1 gram over 1,000, and then equals what? X grams over 1.5 ml. And it's wash, rinse, and repeat. All the examples here, all the same. What's a good thing you should do? You should go, try those examples. Don't look at the answer. See if you can. Now, problem set 6.1. This will be for homework, and I will put an extra addenda homework, and it's on page 182. Let me write that down.
We have 2 homework this week.
Yeah, make up for it. But I'll have this one due a little bit later. The one that's priority would be correcting your exam. Now, let's go to.
Yeah, I read in the book when you saw like one ratio and 1,000, right? 1 to 1,000. You just
put
the
a
proportion. You just do that like fraction.
Yeah, it's just like a fraction.
Then, yeah.
But then if you put it, but if you start noticing, 1 is to 100, that's what? 1 over 100. That's 1%. So 1 is to 100 would be what? 1%. 2 is to 100, 2%. 5 to 100, 5%. Because remember the definition of percent. It's pretty much just a fraction. X over how much 100 is. Now, this stuff I'm just going to briefly go over, because for future training you'll have this in, this is more for chemists. I just need for you to know what these things mean, so that if ever now, what is a milli equivalent? In slang, in the hospital, we call mex. So 1 milli equivalent. So all the milli equivalent is the ratio or the molecular weight, and that's the one you see in, you know, the periodic table from chemistry when you were in high school, right? These, they have atomic weights and molecular weights that are already given. And the valence, of course, is, remember, you have these little electrons and protons that are extra, that +2. In the case of calcium, in sodium it's +1, in chloride it's -1. They're used in to figure out mex. Just know that it's what? From the periodic table, molecular weight over valence. I won't really test you on that, because that's chemistry stuff. But what can I test you is know it, like you can use it like it's milligrams per ml. So let's look at this one. This is on page 186, example 6.2.1. So we want 44 milliequivalents of a sodium chloride solution. And I want to put it into an IV bag. And sodium chloride is available at 4 mEq per ml. So how many milliliters would you add to the bag? If you look to see here, what do we know? We know that for every 1 ml, I have 4 milliequivalents. I'm supposed to do what? Put in 44 milliequivalents. And then solve for x, which is how many milliliters do I add to the bag. Okay, and do the math. And here's your answer. And it makes sense. 1 is to 4 ratio, and I'm making a 44 milliequivalent mixture. I should have what? 11 cc's of that particular drug. So let's see if there's any type. All of them are relatively the same thing. So now that you're introduced to MEQs, just look at milliequivalents as amount of drug. Okay, that's the best way to put it. And the amount of drug that's based on the molecular weight and the valence of the particular component of the drug. The worst I could do, and the rest would be like just like all the other calculations that we did. Now, another thing you'll see is units, abbreviated capital U. So, for example, insulin you'll see is calculated in units. And it's U100 insulin, which is one type of insulin. And it means that in 100 units, there are 100 units in 1 cc. So 1 cc or 100 units per ml. So if you see this, U100, that's 100 units per ml. Okay? And here's your tuberculin syringe or insulin syringe. They're 30 units, 50 units, 100 units. And you can see the you can see how much it is for each. Okay. And actually nowadays, and that's why when you look at the tuberculin syringe, it's got orange tops. And those are the ones that are really, really small, and they're the ones for diabetics. And you can see here, there's a sub-Q injection, so the needle is what? Pretty small. So 100 units would be what? The entire syringe. 50 units would be half the syringe. Okay? Or a 50, in this case, we're looking at this syringe, right? 50 would be here. 30 units would be where? Here. Okay. Because most facilities, why order 3 different types of syringes? Most facilities will have your tuberculin syringe, which is about is 1 cc or 1 ml, and you'll see on one side it'll be in what? Units. So if I want to fill 100 units on my patient, I fill the tuberculin syringe all the way down to what? 100, and I push that. Okay? Oopsies. Another important drug that's in units is heparin. Also, a lot of these drugs, they're in units. And heparin is a blood thinner. Very important. You don't want to give too little because then my patient will clot. I don't want to give too much, then my patient will bleed out. So you have to calculate those. So if I were to give 7,500 units, right, and the label says it's 10,000 units per ml, so I can set up that ratio. And you solve, so then what do I give? 0.75 ml. So if I have a tuberculin syringe, what do? I fill it up to what? The 3/4 line. Because 0.75 or 75% of 100, or give or take, out of 100 units, what can I give them? Like in the syringe, it says 100 units is 1 whole cc. I'll give what? 75. But again, you as the pharmacist tech don't do that, but there are times where the pharmacy technician and the pharmacist do what? You prep my needles, you prep my stuff. So it comes in like a little kit. You prep all of that, make sure everything's good, put the cap back, everything, boom, it's in a little kit, and then when I get it, I just deliver. Okay?
Who prepared it? The pharmacist.
Pharmacist.
The pharmacist.
Yep.
Prepared it, right?
Pharmacist would prepare it. But then look at the protocols. Everybody and their sister checks it. So who checks it? Pharmacist checks it. Whoever the pharmacy manager checks it. The pharmacy tech checks it. Whoever picked up the drug checks it.
The nurse checks it.
Yep, the nurse checks it. I check it. My attending checks it. Right? Look how many people. So if it got messed up, it's not just one person. A whole bunch of people didn't do their job. Okay? So now you know. And here's some Humulin. That is just like your midterm. Humulin R. That is the brand name. R for regular. Right? Here you can see what? How many units? It's in 500. 500 units per ml. So this one is only what strength? 100. So that's only 100 per ml. This one is 500. You're taking this, you're full-blown got diabetic issues. Now, what is a generic? Insulin. That's what it is. Okay. Here's a Humalog, quick pen. How much? 75% insulin. Okay? And 25, so it's a mix. Okay? A mix of 2 different kinds of insulins. So when you see that like a fraction thingy, you see that fraction of 75 to 25, that means there's some sort of mix going on. If you're familiar with these labels, they're typical. There you go. Here's a nice example. So I could give you that label. I could give you that question. Patients received 32 units of Humulin R right before breakfast. They come in 100 units per ml. How many ml will the patient receive on each dose? Okay. Now the math is easy. 1 is to 100, remember, because it's what? U100. That means in 1 ml there are 100 units. How many was I given? 32. So how much ml? You do the math, solve for x, 0.32. And when you look at the little tuberculin syringe, if the gradations are from 0 to 100, what do? Because you know that's 100, it's already 100. Do what? 32. Real life, no real calculation for this.
And
because it's already labeled in
that's
units.
for diabetes, right?
Yep. Because remember, the generic is what? Insulin. Humulin R, which is kind of short for human insulin. Okay. So look at that. Look at that one as well. And the rest are all the same kinds of things. Okay, let's look at this stuff. All right, now we're kind of getting into dilutions.
Dilutions?
Yeah.
So that's a different formula, right?
Yeah. So we're on page 198, and some medications they come in powder form, and they have to be reconstituted. Now what does reconstituted means? When you
mix it,
you got to mix it. You got to add water. So the PV or powder volume is the final volume minus the diluent. Now, or the diluting agent. And again, it could be water, it could be alcohol, it could be oil. So let's look at an example. So you have this antibiotic, has to be reconstituted. The label says that it is dry powder that occupies 0.5 ml. Okay? Using the formula for solving powder volume, okay, determine the diluent volume or the amount of solvent or liquid that has to be added. Okay? So here's some examples. Okay? And look at that. And all I'd have to do is do what? Just tell you what it is, and you should be able to figure out that the diluent volume for a 2 ml final volume is 1.5. The diluent volume for a 5 ml is 4.5. Essentially, you're just minusing what? The diluent volume minus whatever final volume you want to have. Now, why do you do that? Think about it. The powder takes up a certain amount of space, right? And a certain amount of space is what? Volume. So if you're doing a 5 cc, you're going to remove 0.5 cc's. You're doing a 10 cc, you're going to remove 0.5 cc's because that is the space that the powder is occupying. It's kind of weird because when we usually think about powder, right? Think about something that's dry. You usually think about it in terms of weight. But in this particular case, this is kind of a little weird. You're going to think of the powder as like another fluid or another liquid that's taking up an equal amount of space. So those are pretty easy questions, and they can be also applied to the techniques that we've been doing. Now, let's go over real quick. Let's get a this video that we can put. Let's see some videos. Okay, videos. Okay. Ooh, wonderful. Let's see if this one's a nice one. And if it's a good one, we'll put it. Because remember, this is extra outside of. Okay, let me. Okay, I'm going to put it on pause because I'm going to put this video up or something similar. Okay, let me just adjust the height a little bit. Now, I put on Pharmacy Calculations for Technicians, Concentrations and Dilutions by Professor Brad Wojcik, and we want to go over that first problem that he went over. Essentially, the first problem that he goes over on the video is that he wants to make a 100 ml solution. This 100 ml solution that you want has to have a concentration of 2 milligrams per milliliter. Now the problem lies is that the stock solution only comes in 50 milligrams per ml. So this 50 milligrams per ml is a much higher concentration. So we have to do something to do what? Dilute it. And Professor Wojcik talks about it doesn't matter how much water you have, it matters like how much fish. Now his analogy it just means that you're just dealing with the same bowl of water, which is 100 cc's. The only difference between what you're starting with and what you're going to end up with, and this is a dilution, right? The difference is that you are now doing what? You are now adding more water, or another way to look at it is, you're adding less solute. So as you can see here, this is a solution, solute over solvent, or the powder part versus the water part, or the dry part versus the wet part, whatever you want to look at it. So the first thing that you got to do is you have to find out how it goes. How many milligrams your current concentration that you want, and we do it same method that we've been doing it for the last several weeks. 100 ml times 2 milligrams per 1 ml, and the ml will cancel out. So what is our concentration? Our concentration is we need 200 milligrams. I need 200 milligrams of drug in that 100 ml. Now the thing is, I have a stock solution of 50 milligram per ml. So how much should I use? How much of that stock solution am I going to put in a 100 cc bucket? So I start off with my 200. $50 milligram per 1 ml. 200 divided by 50. 4 ml. And for the last and final part, what would I do? I would take 4 ml of that stock solution and put it where? In a 100 ml beaker, right? And then fill up the beaker to 100 ml. So I take 4 ml. So essentially, what am I doing? 4 ml of this 50 milligram stock solution, 50 milligram per ml stock solution, and then 96 milliliters to bring it all up to 100, because 100 minus 4 is 96. Now to say that again, I take 4 cc's or 4 ml of this 50 milligram stock solution, I put it in a 100 milliliter beaker, and then I add what? 96 ml, or I bring up the fluid line to the line that says 100 ml, mix it, and guess what? I now have a 50 milligram. I now have a 2 milligram per ml solution. I now diluted. And that's what we're doing. We're dealing with concentrations and how to dilute them, how to make it less. Because you don't want to give the patient 50 milligrams. I only want to give the patient what? 2 milligrams per ml. Okay? And that is the worst I could do here regarding
so you put that 4 ml to that 100 ml, right?
Yep. So essentially, I take 4 ml of this 50 milligram per ml solution. I put it in a beaker, and then to make 100, add 96. Or you just put it in a 100 ml beaker, because the beaker has lines, and it'll tell you, why measure out 96? Just, there's already 4 in there, just pour until it's to the 100 level mark. And that is a classic concentration dilution problem. Okay? Okay, let's see if I'm in frame. Okay. Now, this is off the video. we just predisposed. Before we wanted a 2 milligram per ml solution. Now I want to make 100 ml of a 10 milligram. So what am I doing? I'm bringing the concentration up. First thing I'm going to do, I start off with 100. mLs cancel out, 100 times 10, now I have 1,000 what? 1,000 milligrams or 1 whole gram. Okay? So that's what I need to be in what? This 100 ml solution. But I have my stock solution is 50 milligrams. So again, I come down here, 1,000 milligrams, and I set up my milligram for 1 ml. Okay, how many ml do I do now? 100 over 5. Now I'm going to take how much of this stock solution? Now I'm going to take 20 ml and put it in 100 ccb. So essentially the recipe would be, I take 20 ml of my stock, and then I add what? 80 ml of water or solvent. And again,
where did you add that 80? Oh, okay. 100.
Because you got to make 100. If I'm already putting 20 cc's in a cup that only holds 100, what's left? 80. Or you just fill it up to the 100 level line. And that's concentration dilutions, and that's the worst I can do here. And remember, it has 2 parts. You have to figure out what concentration or how much drug in milligrams you want, and then you do what? Then you do a multiply, or you make a ratio. Either way, the dimensional analysis method or the ratio method, either way, should get you the answer you need. And I could ask you, okay, then how much stock do you put? 20 ml. Okay, what do I do next? Then I add 80 ml of water. How do I know this? Because I want to make 100 ml of this stuff. And this is what chemists do all day. Okay. Now, an addenda question. I'll raise this. Okay, Dr. Grass, an addenda question is, how do I make the stock? Some of this make some room. What if I were tasked to make this stock? How do I do that? Well, 50 milligram per ml. Let's say I want to make a stock. Okay, so I have to find the powder somewhere. Let's say I want to make 100 ml. Okay? Then I'm doing what? mLs cancel out. 100 times 50, 5,000, or 5 grams. 5,000 milligrams equals 5 grams. All right? So I take 5 grams of whatever powder, and then it goes, and then what do I do? I put it in what? 100 ml. And that will make me this concentration. And then from that stock solution. And stock solutions, you know, we make stock solutions all the time because you can't make every single dilution or every single concentration from scratch. It's a pain. It's easier just to have a stock solution and then dilute it down whenever you need it. Okay? And remember, concentration means what? You're adding more powder or more drug. Dilution, you're either taking away drug or adding more solvent, or water. All right? And that concludes our lecture. Kindly look at Moodle. There'll be a homework assignment due not really a week from now, because the priority should be your midterm items, your midterm corrections, but there will also be other homework due I'll give it like 10 days or so. But look at Moodle for details. All right, thank you very much. ml or 300 cc's, same thing. Now, if I look at the label, okay, the label will tell me right there, it's a little bit fuzzy, that it's